Hello guys, welcome to the second part of Plasmapheresis series. So in the earlier section, we talked about what is Plasmapheresis, what is the definition, how it works, where this word plasmapheresis come from, and what are the component of plasma. So now in the second part, what we are going to do, we are going to discuss the methods used for separation of plasma. So let's begin. So here is a small recap of the previous video where we talked about the definition. So the definition was therapeutic apheresis refers to a group of extracorporeal procedures in which blood separation technology is used to remove abnormal blood cells or plasma constituents. So plasma apheresis or therapeutic apheresis is a group of extracorporeal procedure. Extracorporeal procedure means all these procedures will be taking place outside the body and the blood will be involved outside the body, and since it's corporeal mean it involves blood, in which blood separation technology is used. Now the major objective of this video is to study these blood separation technologies. So let's see. So the plasmapheresis procedure mainly works on two blood separation technologies, and these are centrifugal plasmapheresis and second one is membrane plasmapheresis. So centrifugal plasmapheresis is mainly common in the blood bank around, and the membrane plasmapheresis is the one which we generally do in our dialysis unit using the membrane. So it use membrane, while the centrifugal plasmapheresis use what? It use centrifuge. So that's the major difference between the two therapies. Now let's discuss them in a little bit detail. So we will first talk about the centrifugal plasmapheresis. So it is also known as CTP. Now it works on the principle. What principle? So separation is based on density or specific gravity. Use centrifugal force to separate plasma from cellular component. So here what happens? We have blood, and when we centrifuge it at very high speed, what happens? That the heavier part will settle in the lower section while the lighter part will be above. So this way separation happens, and it is based on density difference of the blood components. Now let's see what is the working here. So blood is collected from the patient. Anticoagulant, usually citrate, is used before centrifugation. Blood enters the centrifuge ball rotating at 2000 to 2500 rpm. So we have taken the blood. Now we start spinning it, centrifuging. Now what will happen? They will start getting separated on the basis of their density or specific gravity. So component separates into layers. Now we can see here a layer formation has occurred. Now what we will do, we will separate the plasma layer and we will discard it. So here this one is our plasma layer. What we will do, we will take it and we will discard it, and the next step will be remaining blood cells are return it along with replacement fluid. So that's how centrifugal plasmapheresis method works. Now what are the special features of this therapy? So the main thing is that the it has higher plasma extraction ratio, so it is very efficient method, and the plasma extraction ratio is around 80% in this, and it also works at a very low blood flow rate. So these are the features, or you can say the pros of this therapy. But the major working of this particular technique occurs in your blood bank. Moving ahead to the membrane plasmapheresis. So it is the second technique that we are going to discuss. So it is mainly used in our dialysis unit. It is based on separation based on molecular size using highly permeable membrane filters. So high permeable membrane filters. So the filters that we generally use in our dialysis membrane, and we call them plasma filters. So what are they? They are highly permeable membrane filter. Now let's see the working here. So first step, blood pass through the membrane with large pores. So the pore size is important, you have to note it is 0.6 micro. Now second step is plasma passes through the membrane. Third step is cellular components are retained. So you can see the blood is going into the membrane, and what will happen? The cellular components will be retained. So and we will separate the plasma and we will discard it. Plasma containing toxin and pathogenic substances will also get removed when we discard this plasma. But now we have to replace this also. So we will use replacement fluid and add it with the cellular components, and that's how membrane plasmapheresis functions. So blood cells are reinfused with the replacement fluids. Now, what are the features of this therapy? So the main features are, it is similar concept to hemofiltration, can be performed using hemodialysis machines. It is simple, cost effective and reliable. Here we have no loss of cellular blood components. Lower plasma extraction ratio is the only drawback here. Around 30% plasma we only able to exchange in one particular session, and it also require high blood flow rate. So this is all about membrane plasmapheresis. Now here is a quick comparison between the both. So first one is centrifugal and second is membrane. So what is the mechanism here? Centrifugal force is employed, and here we employ membrane filtration. Separation is based on what basis? So in centrifugal it is based on density, and on membrane TAP it is based on molecular size. Now the plasma extraction ratio, so it gives around 80%, it gives around 30%. Now we will talk about blood flow rate. Here in centrifugal TP we generally require 10 to 150 ml per minute of blood flow, while membrane TP we minimally require 100 to 250 is the upper range, but generally we require around 200 ml per minute. Here the anticoagulant that is employed in centrifugal is citrate, and in membrane TP we generally use heparin. Now blood volume in circuit. So in centrifugal TP the blood volume is generally around 180 ml, which is higher compared to membrane TP that is only around 125 ml. So this was all about the different methods for doing plasmapheresis. So mainly there are two, centrifugal and membrane, and we talked about them. In next part we will discuss how plasmapheresis works. So this was all about this video. Hope you liked it. Make sure you like and subscribe. Thank you. Have a nice day.